From Lowcountry Orthopedics. Dr. McCoy, thanks for being with us today.
My pleasure.
We want to talk about neck and shoulder pain. And one of the things that a lot of people are perplexed by is when they're having pain in that area, a lot of people can't tell whether it's their neck or whether it's their shoulders. How do you tell, and what do you do?
First thing you have to do is listen to the patient. The patient can give you a lot of the answers just by asking the right questions. Did you wake up with this? Did it follow some kind of aggravation at the gym? You were working out maybe a little more aggressively than usual? Are you partaking in sports using an overhead throwing motion like softball and tennis? Is it something that you were doing around the house, painting a room with a roller, raking in the yard? A lot of these things can aggravate both the neck and the shoulder. So we want to find out, where the pain started and where does it travel to. And then have you done anything for it? Have you taken any over-the-counter anti-inflammatories? Did they help? Did they not help? Is it positional? Is there a certain way you sleep that makes it worse? Is there a certain way that you can comfort yourself by getting in a better position? What helps? And ultimately, we go through physical examination, maybe some x-rays, ultimately possible MRI scan.
Okay. Now, doctor, once you've determined whether it is actually neck or shoulder pain that's causing this problem, what are some of the treatment options that are available?
Well, if they have tried the over-the-counter anti-inflammatories, we may move to a little bit stronger prescription anti-inflammatory. In the case of both neck and shoulder, sometimes you want to take the anti-inflammatory and put it right smack where you want it. An injection, either into the shoulder, sometimes into some of the facet joints in the neck, and then ultimately physical therapy. And if an MRI shows a problem that looks like it might be amenable to surgery, patient might actually be looking at surgical intervention.
Wow. Now, is surgical intervention something that happens often, or is that just kind of something that you recommend only when absolutely necessary?
I'd say in general, evaluating patients over the weeks and everything, I'd say maybe 1 to 2 out of 10 wind up going on to surgery. The vast majority of cases are going to get better with time, stretching, physical therapy, anti-inflammatories.
Great. Well, doctor, thanks for joining us today, and thanks for giving us that valuable information. For more information, you can contact Dr. McCoy and his team at Lowcountry Orthopedics, and that number is 797-5050, or log on to lowcountryortho.com.